Hello everyone, I'm Carla Macias, host of Best Docs Network here in San Antonio, the show that's bringing you some of the best doctors in your area who are part of one of the top medical facilities in Texas, and that is Forest Park Medical Center. Now let's get today's show started by introducing one of these Forest Park physicians, plastic surgeon Dr. Minas Chrysopoulo.
I wanted to get the mommy makeover when I was 16, before I was a mother, because I had a large stomach and it was just very uncomfortable to me, and so my mom always told me, just wait until you have kids and then you get the mommy makeover. So I had my 2 kids, and about 3 years ago is when I decided to start doing the consults and looking into doing the procedure. I thought about Dr. Chrysopoulo. He is a good friend of ours, and he's been recommended by many wonderful people. I ended up getting on the phone with him, and we talked about things. I thought he only did breast reconstruction with, cancer patients. He informed me that he does the mommy makeover as well. We went ahead and made an appointment and got in to do a consult.
A mommy makeover can include several things. We see many patients that have had kids and now are dealing with some of the changes that have come. The breasts will change after breastfeeding or after pregnancy. You don't even have to breastfeed to have changes. There's also the change in the tummy area, obviously, because of stretching of the pregnancy. Women that are considering having more kids should really hold off on having a mommy makeover until their family is complete. If you have surgery like a breast lift or a tummy tuck and then have more children, then much of the work will be undone.
I love the results. He went very conservatively on the breast augmentation. He didn't want him to look fake or anything like that. The tummy tuck is awesome. I've never had a flat tummy before in my life. I have a lot more confidence now. I think that I fit in clothes a lot better. Within 6 months, I was definitely in swimsuits. I would recommend it to anybody. It's been such a good thing. Dr. Chrysopoulo and his staff are amazing. They are always there to help out. They always answer the phones. It's been a great experience with them.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. We're different in many ways than other organizations because our physicians are our owners, they are our bosses. And to that end, we want to do whatever we can to be sure that they get their needs met.
We're here for them, they're here for their patients. And working together, and we're not fighting a bureaucracy, we're not fighting a corporate office that's not even in the same state as us sometimes. We're making what's best for this hospital at this moment at that time. We don't have to wait, and that's what our physicians like, immediate results.
As new things become available, like the Mako robot, some of the new technologies, Forest Park's very quick to want to be a part of those things. If that's something that our surgeon wants or feels like would benefit his patient population, we're willing to do that for them. And that's exciting to have an organization that leaps forward that quickly.
It is just very much more collaborative. They're very involved in their choice of equipment. We try to involve them in any major decisions so that they feel that they have a buy-in to this, they're part of it. One of the physicians said to me the other day, I feel like I've worked with this team for years because they just got the flow down. It just works.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
One of the things that attracted me to Forest Park was the level of commitment, not only with the leadership, but also the commitment from the physician partners. They want the highest level of quality for their patients. They also want an aesthetically pleasing environment for their patients as well. We are going to have great teams where everyone is actively involved in all the decisions that are made in the department. Not only the employees, but the surgeons and the anesthesiologists have also been very actively engaged in helping us make decisions on policy and how we're going to run the department, so it's very exciting. Our operating room is by far going to be the best in the city because of the equipment that we have, because of the caliber of staff and their expertise. The physicians that we have partnered with are all exceptional. The relationship that the OR staff have with the surgeons and the anesthesiologists is much closer than most would expect. They've become more of family to us. One of the things that excites me about this project is we get to start off with a brand new culture and set expectations for exceptional care and pride and commitment to the organization. Instead of going into a culture that's already been established, we all get to kind of take part in creating it ourselves. And it's very exciting for me as a leader, and I think that it's going to be very exciting for the staff also.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and snack at the same time each day. Susan has a question for Dr. Meaney. Will a change in my diet prevent kidney stones?
When you change a diet to increase your water intake and decreasing protein, sodium, salt, caffeine, often you can have a decrease in the formation of stones. And also things like magnesium in the diet and citrate, which is found in citrus fruits and juices, will decrease our risk of kidney stones.
Forest Park Medical Center and their physicians make it a priority to get involved in their communities. They especially take great pride when it's close to home. Up next, we're going to take a look at one of the Forest Park campuses and how they got involved in this year's Jersey Night at the Texas Legends game.
The Miracle League is a youth sports organization for children with special needs. Tonight we're honored by being a guest of the Forest Park Medical Center Frisco and the Texas Legends as part of the Legends of the Game series.
A while ago we sponsored the Miracle League and the Turkey Trot in Frisco, and now we participate with the Legends, and we, again, for sports, for the kids, for families. And a while ago the Legends came and said they are very community orientated as well, charitably orientated. So the three of us came together and chose to do this event tonight. Thought it'd be a good fit. Again, it supports the Miracle League, gets the kids involved in sports, us involved in the community, and the Legends get to give back as well. So we decided it was just a great fit.
Tonight's game is all about Forest Park Medical Center and the Miracle League of Frisco. And really I couldn't be more excited to have two great partners like that here. Obviously being a basketball team, the opportunity to give back to a group like the Miracle League of Frisco, have our youth come out, basketball players come out, those who may not always have had the opportunity to participate in sports. It means the world to be able to put smiles on those kids' faces, and really props to Forest Park Medical Center of Frisco for helping to make that happen.
Forest Park is a culture for us, and it's about being in the community, living in the community, and working in the community, and caring in the community. And that's what we feel we do, and we give back every day, just not only in the work we do, but then when we go outside of our walls, and we give back to the community when we're outside as well.
The Miracle League of Frisco would like to extend a special thanks to Forest Park Medical Center in Frisco and the Texas Legends. Their partnership is invaluable to our organization, and we believe that the partnerships in the community like that help everybody in the long run.
Urology Meaney focuses on the surgical and medical diseases of the urinary tract system and male reproductive organs. Dr. Christopher Cantrill is a urologist here in the San Antonio area. Now let's meet the doctor.
My method of practicing medicine is I think of every patient I see as my mom, my dad, or my brother or my sister. And whenever I approach any problem that they have, I try and think of what would I want my family member to have done for them. And I kind of feel you never can go wrong if you're treating somebody like your own family. You're going to make the right decision for them. I think we really just try and do the best that we can with every patient and make sure that they not only get the best treatment available, but understand the treatments that there are for them. Trying to always be courteous and trying to provide fast care and be there and available when they need us and know that we actually care about them. I really stress that a lot in my clinic, and I think we do a really good job of that.
Vector vision is like a GPS system for the brain. A MRI can be done and digitized to an instrument in the OR. So in real time, you know with your instrument where you are on the patient's skull, within the brain, or within the white matter itself.
Image-guided surgery, or surgical navigation, allows the surgeon to see inside the patient's head before the procedure even begins. Navigation is technology that uses a camera and a computer that is able to track the surgeon's instruments during surgery. Just like a car's GPS is able to tell the driver where he is on a map, surgical navigation gives the surgeon information about where he is on a map of the brain. This information can be used to help the surgeon target tumors, plan surgical cuts, and even make removals. The system can also be used for
The benefit to the patient in minimally invasive brain is obviously a quicker recovery time, smaller incision, better cosmesis, faster healing.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. BestDocsNetwork.com is the right place to find the right doctor for you. On our homepage, you can browse through our gallery of all the different specialties part of this group. One of those doctors you can find on our website is cardiovascular and thoracic surgeon Dr. Francisco Rodriguez.
The issue that I had was that I couldn't eat or drink anything. And I had a lot of acid indigestion. My stomach was very swollen up, and I couldn't sleep at night.
We went to the hospital, and they said that she had colitis, and they ran tests on her, and they decided that they needed to cut out some of her colon. She didn't want to do that. We went for a second opinion. One of the doctors called me outside and told me she was very sick and she was very fragile, and it was best just to leave her alone.
I didn't have any strength anymore. I was on IVs all the time. I couldn't think right. At that point, I said, no, just let me go.
Her family doctor, he's the one that recommended for her to see Dr. Francisco Rodriguez. He was very confident with the procedure that he was willing to do. He was trying to go a route that was not some serious operation. The procedure that my mom and I decided to go with was the vascular bypass.
Carmen came in with a long time history of pain in her stomach. She'd had what was found to be lack of blood flow to her large intestine. She'd been in and out of the hospital, had anemia from all this, and when we found out what the problem was, she had vascular disease, which is blockage of the blood flow to her intestines. Normally, you would have had to been opened to have a bypass to the artery. Luckily, in her case, we were able to fix it with a stent. Minimally invasive, you may be in the hospital for 24 to 48 hours. If you have it done open, you're usually in the hospital 5 to 6 days, and you have a lot longer time of recovery and pain. In an older population, it's a lot nicer to do the minimally invasive because they don't recover as easily.
It was good. In other words, right away, I started eating. I was in bed rest maybe 2 or 3 days. After a week, I was cooking. Everything was fine, you know, and I felt great.
Francisco Rodriguez is truly our guardian angel. Because of him, he gave my mom and my family more time so that we could spend with her and enjoy her longer.
It's a very exciting day, obviously, this partnership, because obviously Forest Park Medical Center believes in excellence. We pride ourselves on world-class service, and what better world-class organization is there than the Dallas Cowboys?
The cultures are so aligned. It's two groups, people, two teams that are really focused on excellence, have a passion for excellence. And it takes the same sort of things to make it work, because it's a team effort in the hospitals as well as on the field. You need the coaches, you need the players, the trainers, you need all the equipment staff here, and in the hospital, the nurses and the physicians, the technicians, all the people who maintain facilities all have to work together.
And really, if you think about what we do in healthcare, surgeries and the complexity of putting together a team, we honestly play the Super Bowl every single day, every patient. Our surgeons are quarterbacks, and they've got a team of great associates. Everybody's got to be the best and brightest at what they do, and together they can finish a game and score a big win for a patient. It's very much like football.
Our goal for Forest Park Fort Worth is really focused on excellence and innovation, and that's what the Cowboys are about. They have a strong tradition of really excelling at what they do, and that's what Forest Park does. We think that is going to be really significant to the community and to their surrounding communities, and we think that not only will Cowboys fans love the Cowboys this year, they're going to love Forest Park.
And if you look at the Cowboys, it's excellence year after year. It's an awesome partnership. The excellence of the Cowboys and the outstanding patient care and customer service at Forest Park Medical Center, you couldn't ask for a better team.
This is the Injury Report. I'm Dr. Stephen Michelsen, orthopedic surgeon with Forest Park Medical Centers. Turf toe, an injury that affects several athletes and can put them on the sidelines for weeks or even months. Essentially, what is turf toe? It's basically a sprain to the great toe involving the ligaments and supporting structures on the bottom of the great toe. The term turf toe came about with the introduction of artificial playing surfaces. The joint involved is called the metatarsal phalangeal joint. Essentially, the long bone of the foot called the metatarsal and the phalanx or the great toe. The first joint is the main joint. It's surrounded by important supporting ligamentous structures as well as tendons and soft tissues and joint capsule. Essentially, injury to this involves varying degrees of stretching, partial tearing, or even complete disruption and dislocation of the joint. Treatment of all the injuries, grade 1, 2, and 3, involve the RICE protocol. This includes rest, icing, compression, and elevation. Also included is some anti-inflammatories, and additionally some supportive devices which may include a hard-soled shoe or a boot. Grade 1 injuries typically resolve within a week or 2 weeks. These are treated with the RICE protocol as well as supportive taping and an insert in the shoe called a Morton's extension. A grade 2 injury is a slightly more severe injury involving partial tearing of the plantar complex. Initial treatment with the RICE protocol, in addition to anti-inflammatories, as well as taping, sometimes a hard-soled shoe or a boot for a short period of time. Range of motion is initiated as soon as the swelling decreases and the patient's able to tolerate. Progression into a regular shoe with an insert called a Morton's extension to provide increased stability and support to the great toe. Grade 3 injuries are much more severe injuries, can be associated with dislocation as well as bony injury or cartilage damage. These sometimes are assessed more with an MRI to assess the need for surgical intervention. Patients are initially treated with the RICE protocol, as well as taping, sometimes casting, hard-soled shoe or a boot. As symptoms resolve, patient is progressed to a firm-soled shoe with an extension, continued physical therapy. Progression to activities could involve 6 to 8 weeks, or even longer. Surgical treatment involves reconstruction of the plantar plate, reestablishment of stability of the joint, occasionally fusion and correction of deformity. Although a turf toe injury may seem like a minor injury, it can sideline an athlete for several months, the entire season, or even potentially in their career. This has been the Injury Report with Dr. Stephen Michelsen for Forest Park Medical Centers.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine, Forest Park Medical Center. Forest Park Medical Center is your destination to better health. Speaking of better health, let's take a look at another doctor who has changed many lives. Dr. Kathy Grove is a general surgeon here in the San Antonio area. Now up next, she will be discussing a mastectomy procedure with one of her patients.
My diagnosis was in 2011. I found a lump. So I went to my gynecologist and he did an ultrasound and I have a lump the size of an M&M. 1 month later, it was the size of a lime. So I went with Dr. Grove. She gave me options. I decided to have the whole tumor removed. That's when we found out I have breast cancer. When I first found out, it was hard because I have 2 kids. I have 2 girls. They were very young.
Claudia, she came to us with a very advanced breast cancer. It required mastectomy. The type of cancer she had is one that tends to occur in both breasts. In her case, we performed mastectomy without immediate reconstruction for the purpose of getting her through her life-saving cancer treatment. I was really concerned for Claudia when she came to see us because she started with a cancer that was very aggressive and very large. Thankfully, she has done amazing. She's recovered very well, and she's coming up on her 5th year following the surgery. At 5 years, we start to think about the possibility of cure for her.
I feel great. I'm grateful with Dr. Grove, with all my doctors, but especially with her because it's been so easy to live all this knowing that Dr. Grove is there for me. I really appreciate the fact that she went out of her way to check if my cancer was genetic because of my girls. She wanted to make sure that if that was the case, she wanted to help them too from an early age. Nobody did anything like that for me, ever. It was amazing. I'm really grateful with Dr. Grove.
I had the privilege and blessing to participate in a humanitarian mission to Rwanda, and I'm part of the Face the Future Foundation team. The Face the Future Foundation team is a pro bono organization which brings together a team of some of the best surgeons in the country to go to Rwanda, a country which has been ravaged by genocide and really has not had a plastic surgeon in country for the last 25 years. And so we go as a team and offer comprehensive facial plastic surgery. And the United States was so blessed and privileged to have craniofacial surgeons and facial plastic surgeons which provide comprehensive cleft lip and palate care. In places like Rwanda, this care is not available. That's why I go to Rwanda, because I feel like I could bring a comprehensive approach to either treat the baby with a cleft lip and palate deformity, the child with a jaw abnormality, or the adult with a bite problem. Last year and this coming year, we treated patients with head and neck cancer and head and neck tumors. There are patients with tumors who are very large, very disfiguring, and we were able to treat those patients in Rwanda. We treated a child with an ameloblastoma. It's a skull-based tumor which had displaced the child's eye, and the child had difficulty seeing and had a disfiguring deformity which caused the child really a lot of emotional problems, as well as there was remaining tumor which was not removed. And so myself and Dr. Long from the Cleveland Clinic and Dr. Bohemi from Johns Hopkins did a combination surgery to remove the tumor, reconstruct the orbit, and then use a leg bone, the fibula, to reconstruct the face. The child woke up and touched his face and smiled for the first time in years. The medical system in Rwanda is really growing and it's really improving, and I believe that in future years and with a continued partnership with humanitarian organizations such as Face the Future Foundation, I think that Rwanda will have an improved healthcare system in years to come.
Has a question for Dr. Peter Fisher. Why would a person come see you after a post-massive weight loss surgery?
I believe that someone like myself who really super specializes in post-massive weight loss body contouring is able to give these patients the results they're looking for. I've been in practice for 25 years. For the past 15 years, I've specialized in post-massive weight loss body contouring. I believe that these patients can and deserve to get excellent results for themselves after their massive weight loss.
Thank you everyone for joining us on another episode of Best Docs Network featuring Forest Park Medical Center right here in San Antonio, Texas. For more information on any of the doctors you've seen on today's show or to request an appointment, please visit our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have any questions or comments, please feel free to email us at info@bestdocsnetwork.com. So long everyone, and we'll see you next week.